Welcome to Healing Through Dentistry podcast,
where we redefine health, wellness, and the power of your smile.
We're your hosts,
Hannah
and Eva, twin sisters, qualified dentists and medical doctors.
This is more than a dental podcast.
It's a journey into profound connection between oral health and whole body healing.
Through personal stories, inspiring client transformations, and expert insights,
we explore how dentistry can ignite energy, relieve chronic pain, and transform lives.
Get ready to discover the extraordinary ways your smile can heal, inside and out.
Let's begin.
Hello and welcome to another episode of Healing Through Dentistry, today with Hannah. And I'd like to share a journey of my recent client. She is a young lady, a young mother of a 2-year-old little beautiful boy. And she found us actually based on seeing a root cause documentary. We might have mentioned this documentary to you guys before. We also do recommend to all our clients to see it before they see us or after they see us. We do have it in our library on Dual Smile webpage because it is a great documentary which follows a young man's journey, health journey, and it is to do with a root canal treatment and with overall health. Anyway, she saw root cause and she found the root cause based on her health issues. She was struggling with hormonal disbalances, thyroid issues. They diagnosed thyroid nodules on her thyroid gland. She has had them checked by ultrasonic and it turned out to be benign. And however, she wasn't feeling well and her thyroid markers were not okay. She also has had a history of Lyme disease and chronic fatigue. And that's why she started to seek, because she was doing all suggested by, Western, quote unquote, Western medicine. And she didn't find anything which helped her. So she started to seek further whether there is anything she can do for herself. And her husband actually found the root cause documentary and suggested she sees it. And because there is very well explained the mouth-body connection, how certain stuff in our mouth can influence our overall well-being. She saw it, and based on that, she found us. And she came over from Slovakia. We're in the Czech Republic, in Brno, the second largest city. So she came over from Slovakia. She traveled about 4 hours to see us for an initial consultation. And her first sentence to me was that she knows after the root cause documentary, especially, that she does have issues in her mouth and it does interact with her whole well-being, because she does not even that she has the symptoms, like general symptoms, overall health issues, but also she does feel locally, especially on her lower right side and upper right side, that something is not right, that something is not correct. And she was sharing, her issues, her hormonal issues, Lyme disease history, and also fatigue. And of course, she has mentioned that she's got a little child. So of course that she's busy and, looking after him. He's only 2 years old. But anyway, when we did the 2D image OPG scan and then the CT scan, which is the 3D image, which shows us in 3 dimensions what's going on, we saw that she's got on her lower right root canal treated tooth, which has had a significant hyperdensity in her bone. And also on her upper right, there were actually 2 teeth, upper right 7 and upper right 6, which is first molar and second molar on her right, where there was root canal treated tooth, both of them. And again, significant bone loss and infection visible. What also I have noticed on her 3D image was that there was a residuum in the area of her lower right wisdom tooth. And also there was slightly impacted tooth on her lower left area. So it's been quite a few of issues in her mouth. And after we have discussed the possibilities, what I suggest for her to do, we have decided to, or she has decided to go for the surgery. And so we have decided to go for the surgery, and we have planned for the removal of her root canal treated teeth and the residuum on the lower right and the wisdom tooth on her lower left. We do follow a strict nutritional protocol. We do recommend to our clients to honor it at least a month before and a month after. And obviously, longer you honor it, better for you. We have mentioned it several times, but basically it's no gluten, no sugar, no processed food, no coffee, no smoking, just to say examples. And the nutritional protocol, and the supplementation protocol, which is based on a high doses of vitamin D. But also there's protein, collagen, all the minerals and vitamins, and it's complex and it's supposed to boost your immune system, so as well as the bone system and metabolism. What is interesting, what I've seen through the Chinese medicine perspective is that both of the teeth on the upper right are actually sitting on a stomach/spleen/pancreas meridian, but also on a thyroid gland, and molars, especially upper molars, especially kind of the master teeth, which are to do with your hormonal balance. Lower wisdom teeth also do have a connection with hormonal balance. And so I was quite excited to see what happens after the extraction. And so after the extraction, what was very pleasing to me that she came over after 3.5 weeks, and she was sharing that her cycles, her periods comes on the time, which she hasn't shared with me before. She hasn't shared with me any disturbances in that sense. She was mentioning only the thyroid issues. But then she was like sharing that her period is on time. It hasn't been on time for 1.5 years before. And for 1.5 years before, she has been experiencing a premenstrual syndrome and spotting like few days before the actual period. And, it's been very long. So 2 weeks in a month, she was actually dealing with her period and with, these kind of hormonal disbalances, which was very annoying for her, as she said in her words. So I was happy to hear that not only that this has improved, she has a significant vitality improvement, and she has had skin improvement as well. What I'm excited to hear soon from her is an update on thyroid issues, because she said she feels much better, sleeps much better, but she is due to a checkup with her general doctor who's going to do the test for the hormones for the thyroid. So I can't wait to hear her story, and I'm just going to share it with you guys when I know. So all the best and take care, and I can't wait to share another beautiful story with you. Bye-bye.
Thank you for joining us on Healing Through Dentistry podcast.
We hope today's conversation has inspired you to see your smile as the gateway to whole body well-being.
To stay connected, visit us on our website or follow us on social media.
If you enjoyed this episode, please subscribe, leave a review, and share it with someone who could benefit.
Until next time, remember, healing starts with a smile.
Take care,
and we will see you in the next episode.